All right, welcome everyone to the Thursday session of Caraconference 2021, Building Health Equity. If you're feeling social today, that's our hashtag is Caraconf, and we have the handle at We Are Caracole on all of our social. And we are Southwest Ohio's AIDS service organization with a mission to positively change lives in the fight against HIV. For today's session, if you have questions for the panelists, please use the Q&A this is about tech stuff. If you have any tech issues, please put that in the chat, or if you're just, chatting with people, put that in the chat. But if you have questions for the panelists, please use the Q&A function. The moderator will be able to see that a little bit more easily than in the chat. If you're on a mobile device, you can still access the chat and the Q&A function. This shows you where you should be able to access that with the 3 dots for more. And we'd like to thank our sponsors. Our presenting partner is MATEC, the Midwest AIDS Training and Education Center at the University of Cincinnati. Our leading sponsor is Gilead, and we also have sponsorship from Thera Technologies and support from Janssen and E19. We also want to give a shout out to our partner, the Ohio Health Modernization Movement. Visit this website to learn more about their work. It is a coalition of individuals and organizations around the state of Ohio working to modernize the HIV criminal statutes that Ohio has. Over 32 states have similar laws, including Ohio. And as at the end of every other session, we have an evaluation. It is required for CEUs, but we do want feedback from everyone. So please, we'll put the link in the chat. It'll also pop up when you exit the webinar, and the QR code at the bottom of today's section in the program will get you to the survey as well. If you are seeking CEUs, that must be completed by the end of the day today, 5 p.m., to receive those credits. And with that, I am going to introduce our panelists. So just a quick note, we were supposed to have Ali Triunfo as a panelist, and she's experiencing a family emergency and will not be able to join us today. But we are happy to have Alana Jochum, who is an attorney and the executive director at Equality Ohio. Alana previously was an associate at Squire, Patton & Boggs, LLP, where she focused on complex civil litigation and international law. She has been with Equality Ohio since 2014, where she has the privilege to continue her advocacy work for all LGBTQ plus Ohioans. So let's welcome Alana. And then we also have Mike Weir. Mike Weir is a senior manager on the Policy and Legislative Affairs team at NASTAD. Weir currently is an elected member and co-chair of the Federal AIDS Policy Partnership and HIV Prevention Action Coalition. Weir received his master's in public health at George Washington University and his undergrad from the University of North Carolina at Charlotte. And then today's moderator will be William Booth, who is an advocate for people living with HIV and is an educator and mobilizer for AIDS Healthcare Foundation. He's also part of the Ohio Health Modernization Movement and works on those efforts. And since we will not have Ali with us today, and we wanted to have 3 panelists, I'm going to step in as a panelist, so we will be able to have a discussion about what advocacy looks like at the local, state, and federal level, which is what we were going for. So welcome everybody, and William, take it away, and I will stop sharing my screen.
Okay, like Adam says, welcome to everyone. We do appreciate you joining us. Hope you learned something today, and if you have questions, don't hesitate. I know myself, I tell everyone, no question is dumb. You need to ask if you want to know. Education is the most important thing, and a lot of this information can be confusing, and it's important that you do ask the questions so we can make sure that we're working towards what's best for you and people you work with. I can rattle, so I'm not going to rattle. I'm sort of turn it over to Alana so she can open her screen and we can start with the presentation. Like I said, don't hesitate to ask questions. Hopefully we can get to all your questions. If not, we can make sure you send those questions to us and we'll try to get that information to you. Welcome. Hope you enjoy. And like I say, be ready, be attentive, and know that we appreciate you joining us. Alana, you're on now.
Thank you so much, William, and thank you to everyone. Just so honored to be here today, and so honored that Equality Ohio is a proud member of the Ohio Modernization Movement Coalition. I'm going to start by sharing my screen, and this is a short presentation that Adam, Mike, William, and I can all comment on, but it's going to talk us through a little bit of state advocacy in Ohio. So here we go. Are we all seeing it, panelists? All right, very good. This is a presentation and training that Equality Ohio does, specifically focusing on LGBTQ advocacy, but this translates to all advocacy that we have at the state level, and I'm going to use one bill as an example. That is a health-related bill, but not HIV specific. So first, just who Equality Ohio is. If you haven't heard of us, again, we're so honored to be part of this coalition, but we educate and advocate for fair treatment of all Ohioans, regardless of sexual orientation and gender identity or expression. And very pertinent to today's presentation, we do this work at the State House, as we're going to talk about, also with agencies, which are governmental departments. We do local work at the municipal level, and we also have a legal clinic in public education. So this is a slide I'm going to go through very quickly, but it's more to orient us that we have bills at the state level. And this is an example of a bill that is a threat to our health and well-being, specifically of our transgender youth in Ohio right now. It is House Bill 61 and Senate Bill 132, which the next slide will go into a little bit more detail about how bills are structured at the State House. But essentially, it would prohibit young transgender people from playing sports on the team with which that matches their gender identity. You've probably heard this in the news. These bills have been circulating nationwide. We do have, sadly, a bill in our House and our Senate here in Ohio. And as we talk about the Ohio legislature, this is where so much of our statewide law is made. Law can be made through cases in the courts, but it can also be made here at the State House. You can see a picture of that. If you've been to Columbus, maybe for a lobby day or to meet with your legislator, you've probably been to this building. Right now, our General Assembly is in the 134th legislative session. And sessions last 2 full years. So our session started January 3rd or 4th of this year, and it's going to go all the way until next December and end on December 31st, 2022. So that means any bill, any policy that is introduced into the session has the ability to possibly pass throughout that 2-year cycle. I want to draw attention here about finding your Ohio senator and representative. I'm going to click it and see if that can work. Good. You have the ability to find who your local House representative and Senate is through the website. If you type in your address and you hit submit or your zip code, that will help you find who your legislator is. So I'm going to do that just as an example. 44102 is mine. I'm going to hit submit. And depending on my exact address, one of these are going to be my legislator. So I'll just quickly do this. I'll put in a address. And you can see, oops. Let's see if that worked. Okay, it normally works when you put your address in there, but you will be able to identify who your legislator is, and that way you know who to be contacting. I happen to know that my legislators are Mike Skindell here and Nikki Antonio here. Finding your legislator is a really important step in knowing who to advocate to, because that is the person who is set at the State House to represent you in all matters. And so going back to our bills that we introduced at the beginning, bills have sponsors often in both chambers, the House and the Senate. And so in this example, we have the anti-trans sports bill is a House bill, number 61, and a Senate bill, number 132. They're companion legislation working their way through both chambers of the legislature. You also want to learn more about the committee where a particular bill lives. So that you can do by visiting the pages on your House and Senate. And again, these are what are called standing committees. These are committees where legislation is heard based on topics, so grouped by agriculture and conservation, or as relevant to us, many will be in the Health Committee. Can't see it right now because of the screens, but you can see where bills will live in these committees, and they have regular meetings, so you can actually watch when a piece of legislation will have a hearing. And I think most important for our conversation here today is this slide, because this really shows the timeline for how policy, how drafted legislation works its way through the state process to become law. And it's a long process, frankly. This slide is short, but this represents sometimes 2 years worth of work and sometimes over many, many sessions. So at the beginning, you're finding a sponsor and writing the actual bill. As relates to our work to modernize Ohio's laws relating to HIV and AIDS, that is the phase that we are in. Right now, that language is being drafted, and we are searching for the right sponsor to carry the bill and introduce it and work its way through the process. Then a bill is introduced, and it's actually given a number and introduced by sponsors. Then it has committee hearings. That's where the bill will live and be considered by legislators, and questions can be answered, testimony can be given, letters can be written in support or against it. That's where a lot of the meat of our advocacy will actually happen, is when it's in that hearing space. Once it has been voted out of a committee, it goes to a floor vote. It doesn't have to go to a floor vote. There is some discretion by the leaders at the State House as to what will or will not receive a floor vote. But if it does get to a floor vote, that's when everybody in the House or everybody in the Senate will actually get a chance to weigh in on that bill and vote for it or against it. If it passes, then it goes to the other chamber. So if it passes the House, it goes over to the Senate. If it passes the Senate, it goes over to the House and goes through the same process. So you can see it's a long process to go through. And then finally, you can see at the very edge of this slide, if it passes the House and the Senate, it then goes to Governor DeWine's desk to be signed or to be vetoed. If it's signed, it becomes law. If it's vetoed, it dies and could go back to the House and Senate for them to override the veto, or it just goes away. And so the rest of our presentation, I think, is going to be focusing on the bulk of this, what you can do in terms of statewide advocacy. Writing personal testimony to be heard by our legislators on any piece of legislation in those committees is hugely important. That's where you can share your story. It does not have to be formal. It does not have to be perfect. Writing down why a bill matters to you and having that be heard by our legislators is deeply important. Calling your legislators, leaving a voicemail in their inbox after hours, or with the person who answers the phone, very important way to advocate for your issues. Those legislators have a pad of paper in front of them where they are keeping tabs. Who is voting? Who is asking this legislator to vote for the legislation or against it? And so it really matters sometimes just in bulk how many calls they get for or against a measure to give a sense to the legislator what way they should vote on a piece of legislation. Writing an opinion piece or a letter to the editor, that's what LTE stands for on this slide. Excuse me. That's when you write your story and publish it in your local paper. Our legislators are paying attention to their local newspapers or to the big newspapers in Cleveland, Cincinnati, and Columbus. Every time they hear somebody talking about something that impacts a pending measure at the State House, they are noting that. And then, of course, most importantly, speaking to your lawmakers directly, having an in-person meeting with them, either when they're home in the district or at the State House down in Columbus, can be one of the most powerful tools for advocacy at the state level. So with that, I'm going to have this slide just jot down our information if you have follow-up questions to this. And then I'm going to stop sharing our slide and kick it back over to William to moderate us now that we have some of this grounding information.
Thank you, Alana. I appreciate that. One of the things I just want to sort of add The slide seemed real simple and short. It's not a simple process. It is a long-term process. Just to let you know, I've been involved with the possible changes of the laws with the HIV status. This is my 10th year working on that to get there. So it's not something simple, but it's something you have to be committed to and dedicated to, and get involved. Also, one of the things she mentioned in her slide is getting involved. A lot of people aren't people who like to get in front of people and speak, but you can write, or you can get a group of people to sit down and write a letter, and all of you sign that letter and send it to the legislator. It doesn't have to be just you individually doing that. Okay, now I'm gonna turn it over to Mike. Mike, are you ready for to educate us all?
I am. So I'm just going to follow a little bit on Alana and highlight both the similarities at the federal level to the state level, but possibly some differences. Like William said, the way that things are supposed to work at the state level are not always how it goes. And it's the same way at the federal level. We at NASTAD represent governmental public health officials who administer HIV and hepatitis programs throughout the country. And so on the policy team, we are spending a lot of our time advocating for funding, but also advocating for policy change. And so in particular, I wanted to speak on the funding portion. So the president every year is supposed to release a budget proposal in February, and that's what starts the federal appropriations process every year. It's supposed to come out the first Monday in February, but that never happens. And so the president, regardless of the party of the president, almost always misses that deadline. But that recommendation is basically a framework of how the administration thinks that federal funding should be spent and how it should be allocated throughout the government. It will take a look at how much to take in as far as taxes, but also how much to spend. Another important thing that budget does is it lays out priorities for the administration as well as funding proposals. So, for example, President Biden put out a budget proposal in late April, early May of this year, and included in that proposal was funding for HIV and hepatitis programs, but also calling for the elimination of the federal ban on syringe service programs, because currently there's a federal ban or a partial ban at this point on banning federal funds to be used for the purchasing of syringes and needles. And so his budget proposal lays out that he thinks that should be done away with. So the next step of this process is what's called the budget resolution. And the budget resolution happens on or within Congress. This is a process that is often overlooked and does not have to take place. But the budget process, the budget committee would develop a budget very similar to the president's budget, but with their own numbers and their own funding priorities. They would then pass that. It would pass the Senate and the House, and then it would basically just be a budget resolution. It doesn't require a president's signature, and it doesn't actually have to pass for there to be any movement on funding. The next part of the process is the appropriations, the actual bills for the appropriations. So the House and the Senate each have their own committees. There are 12 committees in total that focus on basically every agency within the federal government. The one that we care the most about for HIV funding is the labor, HHS, Health and Human Services, and education-related agencies. And so that is where we will spend the majority of our time advocating for appropriate funding. And I'll get into what actual advocating looks like in just a little bit. But those committees will hold hearings, they'll hold markups, and their vote in some way or another on those 12 bills. Sometimes they combine all those bills together to make it easier to pass, which you'll hear about often in the news. That may be a cromnibus, but as a way to pass contentious bills, which unfortunately for us, the labor HHS bill is often a contentious bill because it may have policy riders, it may have funding that one party or another does not agree with. And so our bill will often be tagged along with something like a defense bill, which is an easy appropriations bill to often pass up out of the House. Through that process, if the House and the Senate have different funding priorities, so for example, this year, we've seen different funding levels in the House bill than the Senate bill. The Ryan White program may have got $50 million more in the Senate bill, but not in the House bill. So they will come together the same way that they do at the state level and conference the bill and come up with some sort of solution on the discrepancies between the funding. The deadline for the passage of this bill is actually coming up. It is September the 30th. So our federal government has a funding cycle of October 1 to September 30th. So FY22 starts on October 1. We are not going to meet that deadline this year, and Congress will have to pass what's called a continuing resolution. And that continuing resolution, or CR, will basically fund the government for a period of time while they're still finishing that appropriations process. And that deadline right now is looking to be December. That gives them a little bit more time to figure out those discrepancies between the two bills, but it also allows them to do other priorities that they have. So right now, you may have heard they're trying to pass the Build Back Better stimulus package. And so that has taken a lot of the budgetary time away from members of Congress. So we see a focus there. So overall, there are many ways that we, both as an organization, but particularly as a community, advocate throughout this whole process. We strongly believe in coalitions and the power of coalitions and coming together as one voice. And so we spend a lot of our time in coalition, both with federal partners, but also with state partners, in coming up with, number one, what do we think our programs should be funded at? And so that means that we are reaching out to aid service organizations. We're reaching out to federally qualified health centers, state health departments, to basically try to get an idea of what are the funding gaps, what do you need in order to run a successful program. So in that process, we develop our ask numbers. And that's basically saying, this is how much money we think the Ryan White program needs, or this is how much money we think CDC HIV prevention needs. And we put that request into the president and to the Office of Management and Budget, who drafts the administration's budget every year. We have some meetings with them, we lay out our priorities, and then we wait until February when they release their budget. We're hopeful that they included our numbers, but oftentimes they do not include our numbers because the need, as I'm sure we're all aware of, is often much higher than the amount of resources that are coming in to an organization or to a state and local health department. And so we then will move to the Senate and to the House. And so we'll spend the next 6 months meeting with appropriators or members on the budget committee that oversee labor HHS, or the Labor, Health, and Human Services appropriations. Because particularly on the House side, there are 435 voting members. We solely do focus on those members that are on the committee because they're the ones that are drafting the bills and making the determination. But there are also opportunities to engage with members that are not on the committee because they put in what are called member requests. And so you can send Senator Sherrod Brown a request that will say, you know, we think HIV prevention needs this much funding. And members at the end of the appropriations process will develop what their priorities are that they submit to the Appropriations Committee. So to us, it's almost like a 3-4-pronged approach. We as a community will be advocating. We are also advocating to our members of Congress to be advocating. And then we're also advocating to the administration. And so through all of these processes, we are hopeful that our funding numbers are included. We also may host a briefing with, for example, the HIV caucus. The HIV caucus is a good partner when you're trying to pass either legislation or funding to get them to, you know, elevate your priorities within members of Congress. And so that briefing could include, or almost should include, community partners at the local and state level to give a perspective. I think the most important thing throughout the whole process is that while we at the national level are representing organizations or representing community, it's important for community to also be at the table and engaged throughout this whole process. So whether that be the briefing, whether that be in meetings that we have with legislators, we were almost always try to make sure that someone from the state or that local level will be there to provide that perspective, because it is so important. The only other thing I think that I would add is that, you know, we're always calling for increases in funding. I don't think, I've been at NASTAD 7 years. There has not been a time we have not called for increased funding, but we often don't get that increased funding, unfortunately, because while we think our issues are top priority, and we know they're top priority, and we know that the impact they can have, we're also competing against folks that, you know, maybe only get $5 million a year for some sort of rare bloodborne tick illness, right? And so we spend a lot of time in coalition with outside organizations also to come up with overall healthcare funding. And I think that's a pretty interesting part of the job, because we do think it's so much, in so many ways we are, it's interdisciplinary focus. And I think we really see that when we're looking at hepatitis funding, STI funding, when we're looking at the infectious disease consequences of the opioid epidemic, and how we all have to come together, realizing that our siloed approaches are not always the best route. So that's a little bit about the process at the federal level. There are many similarities at the state level, but I just really wanted to highlight that funding piece, since we do spend a large portion of our advocacy, both as an organization, but also within our coalition, advocating for.
All right. Thank you, Mike. Appreciate that. I have a lot of questions to ask you, so I'm sure there'll be some other questions that will come from the group. But the next person I'm going to ask for is Adam to give us a little bit. Adam sort of got called on the carpet today, so, you know, his preparation may not be as good as he usually presents, but I know he'll do a good job. But he's been involved in some local advocacy work towards it, and I'd like for him to share as much as he can with us. So Adam, you're up now.
All right, thanks, William. And yes, that was a little last minute, but bear with me here, okay, people? So I've got a lot of experience with local advocacy, and the first thing that I ever was involved with was in 2004, the repeal of Article 12, which was an article that the city of Cincinnati had passed in the 90s, and it basically allowed for discrimination in employment and housing and healthcare and really any way that you could think against LGBTQ plus people. So it was a pretty dark time in Cincinnati, and Cincinnati's changed an awful lot since this bill was repealed. And that was in 2004, so I did a lot of knocking on doors, talking to people, had a lot of doors slammed in my face. And that was what got me into like advocating for things. And I've thought before that maybe I would not have continued to advocate for things if it didn't actually go the way I wanted it to. But it did. So it was nice to start off with something where you had a win, I guess, and was able to, you know, give you the confidence to keep going forward with that. So that was before I really got involved with the working in the HIV field and that kind of stuff. And so a few years later, in 2007, I was working for an organization that used to be in town, AIDS Volunteers of Cincinnati, or Stop AIDS. And they're no longer around, but at the time I was a health educator for them. And I was going to a lot of programs around town that were for substance abuse programs. And I had noticed I was going to them kind of, you know, on a monthly basis. I would go and do some education, I'd offer some testing. And then I noticed just really within like a month, it seemed like everybody that was in these programs had changed. But before, it was mostly alcohol or crack or cocaine, that kind of stuff. You didn't really see a lot of opiates in this area at that time. And then all of a sudden I started going, and everybody that was in there was for an opiate related use disorder. And at the same time that that was happening, I was able to hook up with a local doctor, Dr. Judith Feinberg, who used to be with the University of Cincinnati. And she came to Cincinnati from Baltimore and had a wide experience with, people who inject drugs and what health consequences you see in a population like that. And she had been here for probably 15 years and never seen a case of endocarditis in the ER. And then all of a sudden she started seeing multiple a week. And that was a red flag to her. So we both had these red flags going on. In 2007, we got together, we started to bring some stakeholders together. And we were pretty naive and thought that we were going to be able to start a program within about a year. So we were thinking, by 2008, somewhere around there, we'll have this open. It didn't actually open until 2014 because it was a huge uphill battle and they were actually illegal in the state of Ohio at that time. So we had to work on two levels, the local level and the state level. And luckily for our efforts, Ohio is what they sometimes call a home rule state. So municipalities can make certain decisions that may not be completely in line with what the state wants to see. So we were able to get the local health jurisdiction to declare an emergency, a public health emergency, and then that gave us the legal framework to be able to have a program within the city limits legally. We thought that was going to be it happened on February 28th, 2012. And I remember that date so well because I thought now we can get started. Well, that happened 2 years before the program even got started. So, because then we had to start doing more advocacy work with the community to educate them about what is a syringe exchange, what's a syringe service program, how is it going to impact your community? There was a lot of concerns, and we had to address all of those. So that's on the local level. And then just to pick up on what like Alana and Mike were saying, I have done some, advocacy days in Columbus. I've also gone to Capitol Hill a few times with carrying ambassadors. They're a hepatitis C focused advocacy group trying to advocate for the repeal of the partial ban on funding for syringe service programs. And that's, I just want to say, when Mike said they try to bring in people like from the local to talk to the representatives, that's why I was there and I got to talk to a lot of Ohio people, and they really did listen. I was actually, the first time I did that, I was pretty surprised how engaged, even people that I thought were going to be completely against it, who, kind of are on the other side of the aisle that maybe disagree with these kinds of programs. So I think that was really helpful in having those conversations. We were able to, change some minds. And I think that's kind of the bulk of what I'll say. I'll let maybe if Mike or Alana have anything to add, or William.
That's such a powerful story, Adam. I'm thinking, first of all of that, all advocacy is local, all change is local. I think it's so important to emphasize that, because even sometimes the change that ultimately gets taken up at the state level or at the federal level, it really starts with ideas on the ground at the local level. So I want to add that some of the work that Equality Ohio has done and that you may be involved in is changing your local municipal laws. Article 12 was an effort that tried to actually prohibit the ability to protect LGBTQ folks against discrimination. And that effort was monumental in 2004 to overturn Article 12. And since then, Equality Ohio and several other statewide partners have actually been working to proactively put into place at the local level laws to protect LGBTQ folks against discrimination. And so, with that as the foundation, I'll share that Quality Ohio and citizens and residents of Gulf Manor worked recently to pass one of these ordinances. And last year, a group of concerned citizens brought it to their council members and said, look, we should not discriminate against LGBTQ folks, which is legal, even though it's 2021. I can't believe that, but it's not yet prohibited at the state level. We're working to change that. So it falls on communities like Gulf Manor to change that for their local residents. Thank you. Yes, Gulf Manor is a suburb of Cincinnati. Residents there asked their council to take this up. They looked at drafts. We had multiple hearings with lots of local residents adding why they wanted these protections in place, and a lot of opposition saying, no, we shouldn't protect LGBTQ folks, somehow considering that special rights or rights that would take away from other people's rights. And the council had to consider that. They considered their testimony, and ultimately we prevailed, and they did pass a fully inclusive non-discrimination law. And then another group of citizens that was still opposed to it tried to bring it to the ballot to say, no, this should go to a vote of the people. And they did. And so a lot of door knocking and a lot of town halls later, we fought back against that effort, and then we won at the polls as well. So there's lots of different ways that advocacy can happen at the local level. Your council is one method, local ballot issues is another method, and then ultimately elevating local issues to the state and federal level are other ways to advocate for change.
Makes sense, makes sense. The sad part, and one of the questions I've always had and I've had to learn is, even though I have a voice and I have a loud mouth and I will go and present, the biggest problem I found out in trying to figure out is how the system works. One of the things I'd like for either one of you from either issue, either side, each level, why do you have to have a sponsor of a bill over a law? Why do you have to have that? Why can't a public person present that whole idea? So if either one of you could share why that's important, let me know.
Absolutely. This, William, goes to why elections matter. In a democracy, we elect our leaders into systems of government, and that is the person who is supposed to be representing the voice of the people. So every election, not just the big ones, not just in presidential years, every election at the local, state, and federal level matters. Those are the people who are set to represent you. And so that's who you have to go to say, my legislator, I want you to introduce this idea into law, and they become the sponsor and the champion for it at the state house or at the local council, or like Senator Brown or Senator Portman at the federal level. Great question, William.
I would just add, I think there is an important role to also not just focusing on the original co-sponsor is important, but it's also important to get a lot of support around those pieces of legislation. And so that is where you have the advocacy with like a caucus, for example. If you know you have a HIV bill that you want to be introduced or you want to advocate for it, that's the opportunity to go to the caucus or to go to your members within your entire state and say, this is our priority for me, for our organization, for our community, and we think it's important for you to be a co-sponsor or to be an original co-sponsor of this bill. The more co-sponsors you get, particularly if it's a bipartisan group of co-sponsors, the more likely your bill is to get consideration within the committee and to get consideration on the House floor. In a time like right now where they are looking at passing large packages of bills, what we will often see is smaller bills that we spend a lot of our time advocating at the federal level being tacked on. So right now they're looking for ways to pay for a big bill. So they may do drug pricing negotiations. Well, they may also put in a 340B requirement in that smaller package. And so understanding that that your bill that you've been spending, like we've all said, you could spend 10 years advocating for a bill, right? That it may not ever pass simply on its own, but it may get grouped in with a larger package. And it's more likely to be grouped in if you have those co-sponsors and you've put in that advocacy on the back end to make sure that you keep your bill ready at all times. At the end of 2 years, if your bill didn't go anywhere, you have to start that process all over again. And so if you've done the groundwork and you've got your co-sponsors up and you've been engaging with your local members, it makes that process, I don't want to call it easy, but it does make it somewhat easier because you have the groundwork laid and you have your members. What happens sometimes, though, is those members that you've been working the past 2, 3, 4 years with don't win their election. And so then you have a new member that is coming in and you start that process all over again because they're going to have new staffers that may not know your issues. They may not know HIV within Cincinnati. They may not know HIV within Ohio. And so then you have to go in and educate them all over again on what are the priorities for your jurisdiction and for your community.
Thank you. Thank you. I hope that made some sense to other people. That made some sense to me. One of the questions I've seen in the chat was, even though Adam has sort of shared what was a success and what he's been involved with on a local basis, someone was asking, can you share some of the success stories that you've had from your work that you've done? Can you give us an idea of one thing for sure, or at least if you want to list more, go right ahead. Who wants to go first? She passed it to you, Mike.
I'm happy to go first. I think the first two things that popped in my mind were the partial lifting of the syringe service ban, and then the creation of a new funding stream at CDC. It's called the Infectious Disease Consequences of the Opioid Epidemic. We, as a community, had to do a lot of advocacy on both issues. I think some of our successes, unfortunately, I think the reason we had success on the syringe service ban is because we saw such large increases of both hepatitis and HIV among individuals who inject drugs. And so particularly we were seeing those increases in more conservative jurisdictions that had previously been the barrier to getting that ban lifted. And so it honestly took advocacy with particularly Kentucky and Oklahoma because Senator McConnell having such a large role in the Senate, and then Congressman Cole in Oklahoma, who was chairman at the time of the Appropriations, the Labor HHS subcommittee. And so both of those jurisdictions were seeing increases. Both of those jurisdictions had seen increased overdose deaths. And so I think that, and not to forget Scott County, Indiana, folks were able to see what this ban was doing and how it was not good public health. We also had very good data to use to show, because the ban was lifted in 2009 for about a brief year and a half period, and then the ban was put back in place. So there were some jurisdictions, particularly thinking of Baltimore, that they were able to show the benefit and the decrease that happened in new HIV cases among individuals who inject drugs. And so having that, both having the research to lean on, I think was beneficial, but also knowing who were the gatekeepers, basically. And making sure that we targeted those gatekeepers to ensure that they understood what was going on and what those policies were doing and how they were being detrimental to the communities that they were serving. Briefly, the infectious disease consequences, basically the same thing, all the same reasons, but getting new money in Congress is very hard. And so any new money that you can get for your program is definitely a success, and we try to at least remind ourselves.
I just got something I want to add in really quick that Mike reminded me of. It also depends on who it's impacting, and I will say that locally, when we first started trying to get, say, a syringe exchange, a lot of the pushback that was coming towards us, there was a lot of dog whistle words being used, like that's an urban issue, that's not our issue, blah, blah, blah. And then once people started to realize that, oh, it's at least locally in this area, it's a bunch of white people that are at risk because of injecting drugs. People started to change their tune. So I just wanted to put that out there, that all of the other societal factors that we have, like systemic racism, really do impact these things. And that's sometimes why it's so hard, like a lot of people don't care about the people that we're advocating for, or don't think of them as a priority. So that is not a success story, sorry, but it's something that you have to deal with, and something that Mike said made me think of that, and I wanted to make sure that was put out there. It really does, it makes it a much easier if you're advocating for a community that is not marginalized. And all of the communities that we're working with and we're advocating for are marginalized, and people don't, I just saw that was such an issue, and that is the only reason that it took 7 years for us to get an exchange, in my opinion. Not the only reason, but it was an underlying current. So.
Okay, yeah, it's very true, very true. Alana, do you have a success story, or do you want to share
I
with us?
do. I do. I want to share a success story that we had just this past June, because it's the power of quick mobilization. When advocacy organizations that you're on the lists of send out emails or texts or calls for you to call your legislator and give you that number, please take it seriously. It is the power of your voice added up over the hundreds of phone calls that folks get, that sometimes they make changes happen or stop bad legislation. In June, this bill that I used as an example, the Anti-Transgender Youth Sports Bill, it was merged into another bill that was moving swiftly at the end of summer before our legislators went away. Sometimes they do lots and lots of add-ins to moving bills to try to sneak in changes. And we caught this one, and we mobilized all of you to call your legislators and say, stop passing this bill. Do not pass this bill on the Senate side and allow our transgender youth to be harmed. And we directed those to Senate President Huffman and to other legislators on the Senate side and Governor DeWine. And because so many of you acted so quickly and flooded his inbox with emails and phone calls, we know that that pressure helped the Senate not to take that bill over from the House that was coming over, and they instead let that die, and they did not take up that issue to keep it moving in the process to becoming law. So really, that's a success. Sometimes our success is what doesn't become law when we have hostile pieces of legislation moving, and that one was a direct result of advocacy that you all engaged in.
Okay, all right. One of the things I've noticed also with advocacy and stuff is not being afraid to get involved. Like you said, that the quick turnaround with that, and then with Mike, us calling Congress senators and this stuff makes a big difference. I've had a chance, like Adam have, to sit down and talk to her, especially Portman and Sherrod Brown, and they do appreciate it. When you go, you may not get a chance to talk to them personally, but they have health people that work for them that you're able to share that information, and they are the ones who pass it on, and it's very important that you give that information to them. And at the same time, be sure you're realizing, and even it may be a personal thing for you. A lot of times, as Adam was saying, it's not important to a lot of people because it doesn't affect them personally. You have to make them understand how it affects the community in a whole, instead of how it affects you personally, how it affects their everyday living. Now, like I said, I can rattle. I'm gonna shut up and rattle. There was a question that that someone put in, and this is more towards Mike. There is, when we're talking about lobbying, one of the big things that we have in just coming up pretty soon here is AIDS Watch. Mike, somebody was asking how important it is to have that, and how is NASTAD supporting, or how they connected with that program in itself with the AIDS Watch program.
I just put the link in. There is actually an AIDS Watch happening. I guess it's in 2 weeks. Time's a little more. So I think AIDS Watch is a very important process through all of this, and a very important opportunity. I will often tell my friends my favorite part of my job, particularly one of my favorite things is Age Watch, because it's an opportunity to go on the Hill with folks that are impacted by HIV, folks that are living with HIV, folks that care about HIV, to meet with their members on the Hill. And so typically, I will say I have not participated in the virtual Age Watch. They've taken on a little bit of a different form, but in the past, when they were in person, they would be at a very important time. So when I went over that timeline earlier around the appropriations process, Age Watch would typically happen right there at the beginning, at the end of March, early April. And so we would use that time, and I should say Age United is who leads Age Watch every year. We, as NASTAD, would be a partnership organization through that. And so we would help make sure that advocates that are going on the Hill know what the priorities are, know what the funding priorities are. So we would talk about housing, we would talk about sex education, we would talk about syringe service programs, talk about funding, talk about criminalization. We did a whole day of education, making sure folks know how to conduct a Hill visit and the important role that they have in that Hill visit. I think that those lobby days or those advocacy days are a key role in everything that we do. Every disease group that has some sort of national organization, they do these Hill days, because I think we see the results from them. And I will say, Age Watch is probably one of the largest Hill days that we see on the Hill. There's typically over 200-300 folks that are coming. We're all wearing red. We all have our bags on, and it's just a good show. It's a good showing, should I say, of the importance of the issue. And so I know that these advocacy days also happen at the state level, and so I think they're very important at the federal level, but I actually really think at the state level, advocacy days somewhat have a larger role, because we do see so many state regulations, state laws that have a greater impact on individuals' lives. And while the federal level is important, I think we've said this over and over again, the local and state level are also very important. And those state advocacy days are also very important for legislators to understand what is going on. I'm not sure if I answered your question, but overall, Age Watch is very important. And if you have not participated, greatly encourage it.
No, you did. The virtual part, I participated last year with the virtual part, and it was set up enough where you were able to contact the health people who represented congressmen on a Zoom type situation, which was good. At least the message was getting to the right person, and that was beneficial in itself. And so that connection is always good. It's always good. Okay, so we talked about the success stories. Let me hear about a non-successful, something that sort of backed you up, made you think about why are you doing this, and how you turned that around to make it in a positive note. Because with advocacy, our bills, or any situation, it's not always going to be successful. So tell me how something that you worked on that meant a lot to you that wasn't successful, and what you did to change that.
I'll start. We had a loss recently, almost parallel to the victory I shared just minutes ago. In Ohio, the budget takes up much of our legislators' time at the beginning of a general session from January to June. And it's a huge funding bill that funds so much programming in the state. And it also can become a vehicle where they try to take other little smaller pieces of legislation and tuck it into the budget. And so as advocates, we have to be very watchful of what is put into the budget, because sometimes things that we're very much against can try to be tucked into it so that it's harder to fight against them. And sadly, in the final days of the budget being passed, that's exactly what happened. And a legislator put a provision in the budget that said, Any healthcare provider, very broadly, from the person at the front desk to the top doctor in any healthcare situation, could refuse to give service to a person if they morally or ethically were opposed to the service. What do we know that means? It means people could be denying folks PrEP. People could be denying folks birth control or STD protection. People could be denying services to transgender folks or to LGBTQ folks that are related to their healthcare because they disagree with them. So we were furious and infuriated by this because we also know that legislation could not pass if it had to go through that long process I talked about at the beginning. This was being rammed through and sneakily put through in the budget. And so we mobilized similarly, trying to stop that and get one of our legislators to take that provision out of the budget, or to get Governor DeWine to veto that part of the budget. And despite thousands of emails and phone calls, we just were not able to convince legislators to take that piece out, and it ultimately did become law. So that was a huge loss to us. It is the law as of September 30th. That provision will go into place. And so we have been working with hospitals who are also extremely upset at this because they do not believe that this is what the law should be. We're working with hospitals to make sure that folks get served, even if somebody on staff seeks to refuse to give somebody PrEP or refuse to do a service as a workaround. And sometimes, well, I hear you, it takes feeling the loss, licking your wounds for a little bit, and then saying, okay, how can we attack this from a different way? And so we're working to mitigate the harm with those in healthcare provider positions who can ensure that everybody who seeks a service that's offered gets it. We're working to repeal the law through another legislator introducing legislation to take it out. And we're working with partners who go in the court systems and fight these to see if there's a way to say, hey, that shouldn't have been passed as part of our budget, and it should be reversed in the court systems.
Okay. Yeah, it's great, great. Well, one other quick question that someone had, and I think because we're getting near the end, and I can sort of answer it, but at the same time, I'd like to hear from you guys. They were saying if you asked a congressman, statesman to sponsor a bill and they refuse, or do they have the right to refuse? That was the question. Do they have the right to refuse? And if they do, what's the best thing to do? That was the question.
They do have the right to refuse. And if they do refuse, really our only option is advocacy to try and figure out a way to change their mind. I think that happens all the time. So for example, we're working on PrEP legislation, both in the Senate and the House. And in total, there are 3 bills, and 2 out of the 3 have no bipartisan sponsorship. And that is after working with a number of offices to try and get that sponsorship for that bill. But I mean, we're often told no. It could be that they don't have that's not one of their priorities. I think that's often what we would hear. So one office may only focus on Alzheimer's or MS, and those are their 2 health priorities that they focus on. So they may have no interest in the HIV bill or a hepatitis bill. I think what a lot goes into that is what we call building champions. And so if you have a good group of champions on the Hill, that you can lean on them to try and get bill sponsors from those offices that you've had a difficult time with, because they've also been trying to build relationships throughout the Hill. But they have every right to tell you no, that they have no interest in signing on to a bill or even taking your meeting. I mean, we have some offices that just won't meet with us because we're not a priority area for them. I will say, if you are a constituent, you will get a meeting. And so we will often use constituents as a backdoor into an office. So if an office tells us, well, we'll only meet with you if you have someone from the state, we'll start our advocacy within our coalitions to say who from this state can come and join us for this meeting. So they definitely will tell you no in a heartbeat.
Okay. All right, one of the things, I know we're near the end, but one of the things I just want to mention as myself, okay, we may not have Adam's email in the slideshow, but you have these emails of the other people. It's very easy. A lot of people say they don't know how to get involved. One of the things you can do is email these people or with their organizations. If those people, the people that were presenting aren't there, if you want to get involved, then you'll have an idea of what's going on. Sometimes a lot of this is not out in front because it is still in the workings. If you want to get involved, that's how you get involved. Is get in touch with those organizations to see what things are going on and see what you can do to participate and help. It may mean you get on an email list and get blasted with emails.
Oh, I think we lost. I think he got disconnected. His sound went off and everything too. Okay, well, is there anything else? I know, Alana, you shared a situation that didn't go all that well and how you handled it. I wonder, did you have anything to add to that, Mike?
I don't think I have anything to add. I think I have something to add on the opposite end. And I think it's important for us to remember that advocacy is how we got the Ryan White program, and advocacy is how we got the Hopper program. And both programs came after 9 to 10 years of the epidemic. And so I think just for us to remember that is the power of our advocacy, is getting programs, getting funding, and having what we care about for our community and those that we love being a priority for those who we elect and those who represent us. I think all too often, at least I forget about, just the sheer amount of both courage and dedication it took in 1990 to get the Ryan White program, and how much it still takes advocates now to make sure that program stays around and gets the adequate resources that it needs. And so without advocates, without community members, that program wouldn't have been created, but it also would not be maintained 30 years later.
Right. That's a really good point. And then we just have a couple in the chat. There's something from Kate about the modernization movement. And I agree with your statement. It should just be, gotten rid of outright, the laws that are in Ohio. But the reason that OHMM is really focusing on modernizing is because we know that getting it repealed just is not going to happen in Ohio. And when you look at the makeup of who is at the state house and who's in the Senate, who's the governor, it's just not going to happen. So the next best thing is to modernize it and try to root the law as much as possible in the current science, and while also giving people who are living with HIV who may have charges brought against them a way to defend themselves. Because currently the way the laws and statutes are written is they're basically guilty from the beginning. And there's none of this like innocent until proven guilty kind of stuff. And I think there was another part to her question. Oh, where can you learn about strategies? I mean, I think a lot of them are just more common sense strategies. Like when I think of who's representing us in Columbus and how many Republicans there are versus how many Democrats there are, that's the common sense part. Like you pay attention to what both of those parties are into and what their platforms are. They're wildly different. So unfortunately, we have to work within that in Ohio. Maybe that will change some with redistricting, but from what I've been reading, it doesn't look like it's going to change much at all. I wonder, Alana, do you have anything to add to that?
To the redistricting part, maps were just passed yesterday. They are very similar and still very gerrymandered, and it is likely that legal challenges will be brought to them to see if they can be made more open to having contests in each district. So we don't know the answer to that, is the short answer to that question, Adam. Yep.
Yeah, hopefully they'll do something. I mean, for an example, I live in Cincinnati, in Walnut Hills, a neighborhood that's just next to downtown. And I have the same representation as someone in Portsmouth, Ohio. Like, it doesn't make any sense. So, and then we have another question that someone put in the chat. This is a really good question. Could any of us talk about institutional advocacy, like changing policies in large institutions?
Yes. Can I jump in on that one? Oh, I think this is one of the most impactful ways to advocate. We live in systems, and systems are flawed. They are inequitable. They are racist. They are all the things that we know institutions become. And they are still the way that we have to move about the world right now. That is oftentimes what we are going to be up against. And so Equality Ohio specifically, it's part of our mission to transform institutions to improve legal and lived equality for LGBTQ folks. We really contemplate that idea that these institutions aren't going away anytime soon. Why don't we work to make them better and impact daily lives that way? And I think that that is exactly the type of advocacy that any person can engage with. If you encounter a situation with a system with which you have to interact, I'll give an example. Over the years, we were not able in Ohio to change birth certificates to reflect a person's true gender. We were one of 3 states that did not allow that to be the case. We tried to work with the Ohio Department of Health to just change that policy outright. At one point, they were changing birth certificates and they stopped. Why would they not now resume changing gender markers for transgender people because they had before, and it's the right thing to do. And so we tried to do that institutional change. In that particular instance, we were not able to do that change institutionally. Ultimately, a partner, ACLU and Lambda Legal, sued on behalf of 4 very brave individuals who put forth their stories, and that lawsuit ultimately forced the Ohio Department of Health to change its policy. So it's interesting because if you can identify it within the institution, oftentimes you can make change just by some folks who have power within the institution itself to upgrade its policy. But when you can't, if enough pressure is put, sometimes you can use other tools like lawsuits to ultimately force agencies or institutions to change. Great question.
That's all. Sorry, I left for a little bit. My Wi-Fi just decided to cut off, and I was gone. So I had to switch what I was doing. I'm sorry if I missed anything, but I'm sure I didn't. I'm glad to hear that question was a great question on the institution, especially when you think about the penal situation. You know, I've talked to a lot of people with my work. I get out and go into jails, go into prisons. It's amazing how much assistance is really needed for those people, and they're not getting it. And even to care situations, it's just really difficult. So it's important that we on the outside really look and get involved in helping those that are in there. You know, don't be, just because they may have broke a law doesn't mean that they should not live some kind of value to their life. One other question I had, and this sort of deals with the bills and the laws and stuff. It's on more of a technical situation. Why are, like, let's say we develop a bill, why is it attached to other bills in order to get it passed? What is the reason behind that? Why doesn't it go through by itself?
Great question, Will. That system, that slide that I talked about, the different stages of a bill becoming a law, many bills go through that or some level of that. But sometimes, especially when we're getting towards the end of a session, the session is going to die, and anything that isn't passed, all those bills go away and would have to start over again from scratch the next session. Sometimes legislators say, okay, we know that we want these 5 bills to move, and we have 15 other bills that can become negotiating points as to, I will support one of these bills that is going to be moving forward if you attach my other bill into it. And so that's the sort of politics behind this that have nothing to do half the time with the policies that are underlying these bills. This is the real where the sausage gets made at the State House. You may have a bill that we know is going to go for a floor vote, and folks will try to get their bill to attach into that so that they can ultimately get their policy passed, even if it's not going to get decided on its merits on its own, just as a standalone bill. So it's really a tactic and a strategy, and one to be aware of as advocates, that maybe your bill is considered too controversial for whatever reason to pass on its own. You want to find a neutral bill that is going to be passed in which to put it onto, and then it will ride across the finish line with that bill.
Okay. All right. Thank you.
Okay, so let me ask you. Can I add just one piece? It's the same way at the federal level, but we have a lot of what they call must-pass bills. So whether that's your appropriations bill or your defense reauthorization. And so oftentimes those controversial topics or bills or policy riders will be tacked along to those must-pass bills so that they can get through to the finish line. The president doesn't have a line item veto at the federal level. And so it's unlikely that a must pass is going to get vetoed along the way because there is a policy rider or a small tag along. But there are some policy riders that would prevent a must pass bill. And so you just stay away from them typically.
Okay. All righty. Okay, just another question on the bill situation that I've had, and I don't know if anyone else is in the listening. I have my bill presented and it gets to the level where they get ready to vote on it, but somebody wants to amend the bill. Do you, as a person or a group or organization has sent this bill in, have a right to have them pull the bill, or do you have to let the bill go through with the amendment that's being offered?
You ask excellent questions, Will. This is the hard part. Only our legislators, our elected officials, ultimately have control over what is put forward for a vote and if they vote for it or not, and if amendments get put in it or not. I'll give the example of the bill that we helped to stop. Ohio State University had a bill, and many other college entities, that dealt with name, image, and likeness for sports. It was a bill that had lots of bipartisan support. That is the bill that some legislators in the House tried to put the anti-transgender sports bill into, and ultimately did pass it on the House as a joined bill. And when it went to the Senate, we and all of you called to try to stop its movement at the Senate side. But Ohio State University, one of the biggest backers of that bill, actually said, nope, we withdraw our support because we support our transgender athletes, and we would rather this not pass at all than pass in its joined version. So as an advocacy strategy, it's really important to have a coalition of folks who are on the same page with you. And if something bad gets amended into a otherwise good bill, they can work to try to stop it. Or if they have a good bill that your bill could get moved into, you've talked with them in advance to say, yes, you can merge your bill with my bill. That's why broad coalitions of support are important.
Okay, thank you. How about on the federal level, Mike? Is there anything that can be done if something gets amended, changed?
Advocacy, I think we have seen is about all the cards that we have when it comes to amendments. The hardest part with amendments is that we often don't see the amendments until the day of. And it can be when they were just doing the reconciliation instructions in the Senate, there were over 500 amendments that they had to go through. And so, as you can imagine, I don't have the time to go through 500 amendments and see which ones are detrimental to our causes and which ones are good. That's where the coalition comes in, and the power of having 10, 20 organizations all caring about the same thing. they can, as a coalition, we can, determine where should we be focusing on our advocacy. If there are amendments that we do not support or we do support, we will send a letter to the appropriators or whoever is considering the amendment, if it's still within committee, and saying, this is why we support the amendment or this is why we don't support the amendment. That is also where your champions that you have been working to, educate and to be your champion, that's where they play a role. At the federal level, Congresswoman Barbara Lee from California, who represents Oakland, she's the co-chair of the HIV caucus. She's on the Appropriations Committee. She is our champion. So if we see amendments that, we think are detrimental, we'll reach out to her office. We'll give them talking points. We'll help them understand why we think it's detrimental. And then we lean on them to be our advocate in the committee room. Because at the end of the day, it's the staffer, or not the staffer, it's the member of Congress who's going to be voting on that amendment. And so we want to make sure that they have the tools to help educate their partners and their members. But it does go down to advocacy. I think I will add, and Alana has mentioned it many times, contacting your member of Congress. They really do keep track of those calls and those letters. I interned on the Hill, and I always tell people, I was shocked at the sheer number of people that call and send in letters to members of Congress, and the amount of energy that is taken into recording those correspondence, but also following back up with them. And so members really do care that they're being contacted and their constituents are saying they either support or oppose something. They take your name and they take your zip code. And so it really, that local perspective really does inform members in how they look at pieces of legislation and how they look at policy issues.
Okay.
Well, I'll just add one thing. We've talked about the state level and the federal level and the role of amendments and the unpredictable nature of them. I will say that at the local level, it's a little bit less intense, and that is an area where we often have a little bit more control. Amendments still happen even in our local non-discrimination ordinances. We've seen them come in at the very last minute and then had to work to either encourage our legislators to, or our council members to support or oppose them. But it is a little bit less intense, and most pieces of ordinance work go through one at a time at the local level. So that might be something, as folks are advocating, to be aware of. You're not going to have some of this sophisticated level of fighting as often at the local level. It'll be more straightforward.
Okay, alrighty. Thanks a lot, guys. Appreciate that information. There's a question in the Q&A, and it's more tuned towards what may be presented this evening. It's dealing with particular HIV law situation, but we want to sort of stay on track with this situation of policy and advocacy. And if that person that put the question in don't mind us answering that question tonight, I'd hate to bring it up because we could get into a lot of questions about the law and HIV and particulars with it, because it could change what we're discussing into something else totally different. So I want to find out if anyone else has any other questions concerning policy and advocacy, because it's, if, like I said, no question is too dumb. Please don't hesitate. I know you may have something in the back of your mind that you've been wanting to ask. Here's your chance. I'm gonna ask both Alana and well, all three of you. How hard is it for, let's say I have a question and I reach out to you, how long a time period would you say I would get a return answer from you? Because you guys are busy. I know some people are real impatient about getting a return answer. Give them an idea of how long it may take for you to give them an answer dealing with something that's policy related, or and what they can do and get involved. You are so attuned. Well, it's amazing. I think I get
over a couple hundred emails a day, if you can believe that. But I do my very, very best as humanly possible to respond to each one, or to reply, to flip it to someone else on our team who could answer it better than I could, or more quickly than I could. And I would say within a couple weeks, I'm usually able to keep up with my inbox and get through everything. But great question. And I think I also see another one in there around door knocking, just flagging that. I'm not sure everybody can see that.
Okay. I may have missed that one when I went away.
I try to give people at least an initial response within 24 to 48 hours. I got your question. I'm following up. I'm trying to find an answer. Hopefully the answer doesn't take too long to find out. But we try to be pretty responsive, because as a membership organization, I mean, that's why we're there for our for health departments in particular, when they reach out around policy issues. I think this is not necessarily your question, but I did want to add in around the institutional policy and looking at them. It is a very important focus for NASTAD, in particular around making sure that we are helping health departments look at their internal policies and understanding the systemic oppression that may be included in those policies, the systemic racism that may be included in those internal policies, and how can they, as a jurisdictional health department, update them. I think the conversation we've been having is important in the sense that sometimes those policies can't just be updated internally. They may take a legislative change, or something passed in the General Assembly in order for that policy to be updated. But they don't know it. They don't know what it takes to do that until it's been identified. And sometimes the health department is able to identify that internal policy, but oftentimes it's the community that's coming forward and saying this policy is detrimental to the clients that you're trying to serve, and needs to be revisited or relooked at.
Okay. How about you, Adam?
I would say very similar to Mike. I try to get an initial response within a day or two. And if, depending on what the question is, and I need to do some research or connect with other people, it might take a little bit longer to really get, the information that you're looking for. But, in a reasonable amount of time, I think. So.
Okay. So I know for myself with, I represent the whole state of Ohio. So sometimes you get anywhere, as Alana said, anywhere from 100 to 200 emails a day. And some people expect you to answer as soon as you get the email, you're supposed to answer back to them. So sometimes it's real difficult to get back to people. And I like people just to understand. It's not that we're avoiding, that sometimes it takes just be a little patient, and we'll try to get to you as much as we can. Now, Alana said there was a question about door knocking, and it must have came through when I lost Wi-Fi. It's not showing up. Could you share that question with the rest of the panel?
Sure, I can do that. It just says, can any of you share an example when you were advocating, say, door to door, when you were not received well, and how you would handle this kind of situation? So I have an experience. I have a lot of experience with that. With the Article 12 repeal, I had to go door to door in different neighborhoods, and they assigned us to certain neighborhoods. And one of the neighborhoods I got assigned to was Westwood, and a part of Westwood that is a little conservative, maybe more so than the rest of the city. And I had a lot of doors slammed in my face and was called a lot of names. And it was kind of an easy situation because all I had to do was leave. I was on their property. I was at their front door. Like, if that's how you're going to answer your door, then I'm just going to turn around and walk away. Like, I'm not going to engage with you. So I think that's been my policy, is when people get really angry or really heated about it, which there was a lot of that around the exchange and trying to get that open. You just try your best not to engage in that, and try to engage with people who are reasonable might be the word, like people who are willing to engage with you and not at you, I guess. So that would be my experience.
I think that's right.
Go ahead, Alana. I'm sorry.
I haven't done a lot of door-to-door advocacy, but I have gone to many a meeting with staffers on the Hill who never open up their notebook and never write a single thing down in the 30 minutes that we are talking to them. I think those are particularly the hardest meetings when you have constituents with you, because the constituent has traveled a long ways oftentimes to come and meet with that staffer and that member, and they just do not engage with you at all. And I think all you can do as an advocate is making sure that you provide the information and the knowledge that you have, and hope that they're receptive. I will say that there are times where, you know, we think that a member would care a little bit more about our issue than that staffer did, and we have no problems going up to the next staffer because there's always a hierarchy within an office. And sometimes when you make that meeting request, they send you down to the low staffer, and it doesn't go well. And we'll make our way up the chain until we get to the chief of staff or the policy director, because at the end of the day, they're there to meet with you and they're there to listen. And they should engage, particularly when you have constituents coming in. So there's always a way to work around it. But I will, when I'm leading a group on the Hill, I do try to tell them, don't take it too personal. There are some staffers that are just not, they're just there to be there. And your issue is still very important.
I love Zoe's comment to everybody, the movable middle. Yes, that is a focus for our efforts as well. And I think it goes to the concept of no matter what political party affiliation you have, you may need a journey story on whatever issue you're learning about and learning to come to support. Focus on the folks in the middle who might be more receptive to that story. And to some degree, if you get a clear signal that someone is hostile to your issue or hostile to you as an advocate, I always say, save your energy, move on from that person. There's someone else more worth that conversation. And maybe some other point in the journey, that person will be open to a conversation if they're not now.
Okay, I agree with you. One of the things that Michael was talking about with and going to the Hill and discussing, I had a situation where I had a health person who you could tell was not caring exactly. They were meeting because they had to meet. So I ended up, we gave our presentation, and usually I don't get upset because I know that this happens. But one of the questions I asked them, I said, "Can I ask you a question?" They said, "Sure." I said, "Have you ever been tested for HIV?" And I said, "I'd like an answer today if you could give it to me." To this day, that person and I email constantly because he said no one had ever called them on the corner enough to make them respond. And now they listen to me, and they said they made them appreciate what we were talking about even more so. So sometimes being a little bit of an ass can get you through the door to make someone listen to you. But sometimes you just have to walk on, as everyone is saying, you have to walk on, dust yourself off and keep going, because there's always someone who will be against anything you say. And there's always people who will agree and even be there to support you. Are there any other questions at this point?
I don't see any. And William, you make a really good point. Like, sure, you're working with people and advocating and stuff, but like, sometimes you can't be all nice and fuzzy if you're trying to get your point across. Sometimes you do need to, be a little bit more forceful and more aggressive about it. So. And we're at time.
We did not talk about.
I'm sorry?
I said a whole other level of advocacy we did not talk about. Actually going in and doing die-ins and, making sure that if they're not going to listen to us that way, well, then you're going to listen to us this way.
Absolutely. Well, we're at 1:29, So this was a great conversation.